Biomet is a global leader in orthopedics, spine, trauma, and osteobiologics. This animation presents an innovative posterior three-dimensional spinal deformity correction technique that utilizes the power of the Polaris spinal system fixed-head pedicle screw fixation, incorporating a unique helical flange locking mechanism to optimize efficiency and clinical outcome. It has always been the desire of scoliosis surgeons and systems designers to achieve three-dimensional correction since Cottrell and Dubosset introduced the concept in the late 1980s. With fixed-head pedicle screws placed strategically about structural curves, we now have the power to do so. The etiology of adolescent idiopathic scoliosis is unknown, although there is a genetic predisposition. The deformity classically starts in early adolescence and progresses through the rapid phase of growth. The apical vertebrae of major structural curves rotate in the axial plane, often with an associated thoracic hypokyphosis. Fixed-head pedicle screws can be preferentially clustered in groups of 5 to 7 about maximally rotated apical vertebrae and upper and lower end foundations. Very frequently, there is significant rotation of the vertebral bodies at the apex of a scoliotic curve, making it difficult to prepare the pedicles on the concave side. Derotation levers can be used to realign these pedicles into a more anatomic vertical orientation. The derotation levers can be held in this position using a sterile gauze roll. The gauze roll is tensioned downward, thus derotating the apical vertebrae. This procedure enables the concave pedicles to assume a more vertical position, making them easier to prepare. In this example, pedicle screws are inserted into the concave side of the major thoracolumbar curve. A foundation of 4 to 5 screws is placed at the upper minor left thoracic curve in this double major pattern. This foundation influences correction of this curve and helps in leveling the shoulders and decreasing left scapular prominence. At this stage, a bone planer is used to remove impinging bone from the thoracic transverse processes and facet prominences in the lumbar spine. The inner blocking ring stops downward travel of the planer at the appropriate depth. The removal of excess bone allows engagement of the soft tissue retractor and facilitates connection of the instruments, such as the rod persuader. Using the hex end wrench, the measured and cut rod is oriented so that the black stripe is seen on the dorsal surface of the rod. Using the example of a double major curve pattern, the rod is pre-bent with a French bender to match the desired sagittal profile. Both rods are placed simultaneously. Pre-bent rods are also available. For ease of engagement, they are placed according to best fit. For example, the thoracic kyphosis curve bent into the rod matches the right thoracic curve. The derotation helical flange plugs engage the top loading screws easily. Rods can be manually aligned, progressing in a caudad direction. A rod persuader is useful when further downward travel of the rod into the screw seat is required. At lower caudad levels, the rod manipulator can be securely applied for more power for rod centralization and engagement into the screws. The rods are connected with a cross connector loosely placed. This can be done between the thoracic and the thoracolumbar clusters where less bone excision is required. Rods are then simultaneously rotated into the desired straight coronal plane orientation. External 3 or 4-point pressure helps in larger curves. The dorsal black line on the rod should be centralized on top. The desired longitudinal rod position is verified, taking into account curve lengthening or shortening with correction. Stiffer curves require the use of rod rotation vice grips. Next, the cross connector is fully tightened. D-rotators are applied to the screws, starting with the right thoracic cluster. The plugs within the screws are not yet fully tightened, which facilitates the derotation. The slots in the handles of the derotators are aligned manually. A handle linkage rod slides through the innermost set of slots in the handles. A comb is applied to the cluster on the right thoracic curve. Another comb is applied to the left thoracolumbar curve. If a comb does not drop on easily, use the second groove on the double-grooved side of the comb. Now, the other side of the comb drops into place easily. The two curves are slowly derotated simultaneously by rotating the derotators in opposing directions over approximately 15 seconds. With desired axial plane correction achieved, cluster alignment rods are added to hold the correction in place. Holding a slight overcorrection will account for elastic rebound in the construct when instruments are removed. A vertebral horizontalizer instrument can then be used to level non-level vertebrae, providing simultaneous single-level compression and distraction with no net spinal cord elongation. A T-handled horizontalizer is available if so desired. Once the principal major curves have been addressed, attention is turned to the cephalad foundation. The thoracolumbar cluster instruments are removed, and the derotators are set up and linked on the upper foundation. Derotation is carried out between the two thoracic curves. In a tight space, for example, the concave side of the left upper thoracic curve, a wedge distractor can be used between the two right concave side derotators. The wedge distractor is inserted down to the rod and angulated longitudinally. The two plugs are tightened provisionally, then the wedge distractor is removed. Horizontalization is completed with the small horizontalizer, and the plugs are tightened with the torque driver. All of the instruments are removed. This completes our three-dimensional scoliosis correction. As a global leader in the spine industry, Biomet Spine provides a unique three-dimensional spinal deformity correction system. This innovative stepwise progressive technique facilitates efficient spinal deformity correction. For further information on Biomet Spine, please contact your local representative or call Biomet Spine at 800-526-2579.